Hello and welcome to the Real Life Cafe. This is the Parenting Corner with me, Juliet Njero Muremi. Today I am excited to discuss a very interesting topic, antenatal care. This is very important because every expectant mother has to go through this so as to ensure the mother and the baby are safe throughout the pregnancy. With me, I'm joined by Dr. Ruth Wamai. She will tell us more about herself before we get to the discussion. Hi, Dr.
Hi, Juliet.
How are you today?
I'm fine, thank
Good
you.
to have you.
Thanks for having me.
So tell us, who is Dr. Ruth and tell us what you do.
Okay. My name is Dr. Ruth Wamai. I'm a consultant, obstetrician, gynecologist. I offer reproductive health services to women of all ages, and that includes pregnancy care, fertility, and any other gynecological problems.
Yeah. Wow. One thing that caught my attention,
Yes.
you know, I just live nearby. I realized you have very special offers for pregnant women, babies. So why is that? Because even when I'm walking around, I can see cartoons all over. Why is that? Why women? Why kids?
I think for me, Juliet, it's more of a bias because I'm a gynecologist. I have a lot of passion for providing care for women and making them understand themselves and also the children that they are taking care of. So it's important that women have a very positive experience in terms of reproductive health. And I think because of that, that's why you're going to find we're very biased towards women and children.
Wow.
Yeah.
That's interesting. And you know, our topic today is antenatal care.
Yes.
So someone there might be asking, what is it all about? So tell us.
Okay, so antenatal care is very important. It's the care you actually offer women when they are pregnant, throughout their pregnancy until they deliver. But I'd like to actually say really women should actually have even preconceptional care.
Wow.
So even before a woman gets pregnant, it's important for her to have seen the doctor first so that, you know, the doctor can prepare her for her pregnancy so that by the time she's pregnant, she ends up having a healthy pregnancy and a healthy outcome at the end of the pregnancy. And actually, not only does it really end after delivery, but even after delivery, we still follow up the women for about 6 to 8 weeks, which is like postnatal. And then we take care of you until you're out of that reproductive phase, where if there are any complications or any other issues that need to be managed, then we are able to see you through that.
Okay.
Yeah.
Wow, interesting. You said one should start seeing the doctor even way before being pregnant.
Yes.
But now you're there, you've conceived, you're supposed to attend to the clinic. At what time?
Okay, so if it's possible for anyone who is able to plan, if you're planning to get pregnant, then it's ideal to see the doctor even before, at least even 3 months. So
okay, 3 months before.
Wow. Before getting pregnant.
Wow.
Because you want to have just a general checkup, you know. Do you have any medical conditions, like let's say an issue like hypertension that maybe needs to be controlled and managed before you actually get pregnant? Then even before you get pregnant, we can offer you supplements like folic acid, which help you to prevent abnormalities in the baby. By the time you're getting pregnant, you get pregnant when your body is also healthy. Do you have, I would say like anemia, a low blood count, which affects your, it's affected by your nutrition. That can also impact on your pregnancy. So it's very important, or even conditions like diabetes, your sugars need to have been controlled even prior to pregnancy. For those who are able to plan, then it's important at least 3 months before. Come and have a sit down with the doctor, get all those managed so that by the time you're starting your pregnancy, you're starting like in optimum shape, I would say. Yeah. So if you get pregnant and you find out you're pregnant, as soon as you know you're pregnant, then you need to start the clinic. So a lot of things will go on during your clinic. It depends on the trimester. So the whole pregnancy period is about 40 weeks, and we divide that into trimesters. So first trimester, second trimester, third trimester.
Okay.
So we use antenatal care really to offer the woman health education in terms of her nutrition, because your goal at the end of the 40 weeks is to have a healthy mother and also a healthy baby. So you also want that journey. It's really a journey of 40 weeks. So in first trimester, you come in, you have your checkup. It's important that there's some tests we do. We need to know about your blood count. We'd like to know what your blood group is. We also screen for viruses like HIV, hepatitis, and syphilis. Those are the conditions that a mother can transmit to her child. And also, we also check what your sugars are, because some people also have maybe diabetes in pregnancy. And we also will do a urinalysis. That's like a general checkup. And during that time, we'd like to know your blood pressure, because pregnancy for some women makes them get a hypertension. Yeah, and it's also important to at least have a first trimester ultrasound. This is where we confirm that the pregnancy is growing, fast growing in the right location. Is it inside the uterus? Because remember, some women can have what we call an ectopic pregnancy, where the pregnancy is now outside the uterus, maybe on the tube, which is now actually life-threatening. So that needs to be managed before it becomes a complication. And then, you know, some people also may have miscarriages in first trimester. So it's important for that period to be managed properly, and then transition, because the first trimester is mainly when the baby is doing a lot of development, what we call embryogenesis. So that's the main stage between 0 weeks to about 12, 13 is when you're having the placenta growing, and also now the baby, basically the organs are developing. Yeah, so it's very important to at least see your doctor, start your visit from there. And then now from there, you have scheduled visits. What is ideal and what is recommended by the World Health Organization is that you should have 8 visits minimum throughout your... 8, yeah. Through 8. So that you're basically talking of about a visit every 4 weeks with your health worker. So it's important that you start. Yeah.
In the world we are in, we have many, you know, especially the first time moms, you're getting advice from different people. Huyu anakuambia hivi, huyu anakuambia hivi. And at the end of the day, you find that most first time moms, we are very confused. We even don't know what to do. Mwingine anakuambia nilianza clinic nikiwa na wiki moja. Mwingine anakuambia nilianza na 1 month. So what would you tell moms out there in terms of, you know, when it comes to trying to get the word of advice?
I would say your advice has to be from a trusted source. So, but because this is, you know, you're going to be in the care of doctors and maybe midwives, it's important that your reference point is at least maybe your health system. So your doctor or your midwife, because then if there are any medical complications, then they will be able to pick them up better than maybe a relative. But I would say use a trusted source, because then that way they guide you in the right direction. And then even you, with the information that you have, you can share that information with your spouse, your relatives at home, your extended family, so that they can use the correct information to now support you through the journey. Yeah.
And what kind of supplements do you give to the moms, and what kind of assessment do you do so that you can know what to give, what not to give?
Okay, so like I said, during the various trimesters, we'll be doing a lot of tests. So first of all, when you come in, I would have to first of all take a history from the mom. You know, what does she have, any conditions that she has been living with? Maybe diabetes, maybe you have even HIV. You need to first of all prepare. So you take a history and find out exactly what is the patient going through. Then you'd like to know this pregnancy, how old is the pregnancy? So you need a date, maybe of the last menstrual period. You go through the history. Has she had any other previous complications from pregnancy? Has the mom had any losses, you know, recurrent miscarriages? You need to find out from her. Has she had, you know, just any other medical complications during pregnancy? Once you establish that, then now you examine her. So physically you check and see whether there are any signs that you find which are abnormal. Does she have signs of anemia? Does she have signs of maybe even thyroid disease? Then you also want to, or any other, you know, medical conditions, chronic conditions that she's living with. And then you also use an abdominal exam to find out whether the pregnancy is growing according to her dates, and then maybe finally advise maybe for an ultrasound just for it to correlate. Then from there you do some of the tests like we talked about. Maybe I'll take an example of a blood count. So if I check your blood and your blood is low, then that means I would have to supplement you with something like iron, you know, and also give you nutritional advice on foods like you can take, which will help to build up your blood count, because it's important that if the woman is well nutritionally, her pregnancy is good, and that means even for her baby, the baby also grows accordingly and appropriately, and you also prevent some abnormalities like things like cleft lip. So if a woman has a folic acid deficiency, you know, there's a risk of a baby having, you know, like a cleft lip and other, what we call neural tube abnormalities. So based on what you find, that will really guide the doctor on what you need to first of all even maybe treat. Maybe there are conditions that you need to first of all even treat and eliminate them, and then supplement maybe like with iron, folic acid, or even calcium. Yeah.
And you've touched something very, very important, and most of the times you find people maybe ignore or don't know how to go about it. Nutrition. Tell us, how should an expectant mother, you know, what are the do's and don'ts when it comes to nutrition? What are the things not to eat? What should you include more in your diets?
Okay, because we come from, you know, different communities, different cultures, people are eating very different things. But what I would advise first is a balanced, your diet has to be balanced. So on your plate, you should at least have carbohydrates, you should have proteins, you should have vegetables, and then also making sure you're having intake of some fruits. Also remember that you should hydrate, and continuous hydration, because it's important that you're replacing fluids. Yeah, and some of those fluids also have maybe, you know, you balance your what we call electrolytes in the body with your fluid intake. I think it's important to increase things like dark green vegetables. Dark green vegetables. They really help with even just increasing things like your blood count, because they provide a source of iron, and they also help maybe with preventing constipation, because pregnancy itself is going to cause a constipation. So it helps with the roughage, yeah, and even something like hydration. We also sometimes supplement even fish. Fish is good because it has the omega oil, so it's good for development of the baby. So that would be a good addition to have. But we must acknowledge that pregnant women have what I would call maybe appetite disturbances. You find like you're very, very, very nauseated, you're being unable to eat. So sometimes we also encourage, when you have the opportunity and your body allows you to eat, please ensure you do a balanced diet, because that's the opportunity you have for eating. So make sure you're having a balanced diet and hydrating well. Then avoiding things like, okay, we know the toxins, so of course avoiding smoking, avoiding alcohol, and avoiding drugs. You know, the reason why I'm smiling is because when I was expectant with my son, hey Doc, I had cravings. I don't know whether it's cravings or actually that pregnancy was different from the girls, two other girls. First months, I usually lose appetite, so I will lose weight. I don't feel like eating, and whatever little I will eat, I won't vomit. But now with my son, again, loss of appetite, but whatever I could eat, I could vomit. So I had a very interesting kind of a mood whereby nilikuwa tunataka kukula chips. You see, junk, like chips, pizza, those, you know, all those junks. So I remember at some point I sat down and I was asking myself, okay, am I doing justice to this child? Because whatever I'm eating, honestly, in my mind, I know it is not right. But that's what I feel like I want to eat. So is there a way one can go about, you know, overcoming the cravings? You know, it's very interesting that you say that, because pregnancy changes a lot. It changes the woman's body a lot, you know. Even you might find things that you liked you no longer like, yeah, because of all the hormonal changes that are happening. So we still acknowledge, you know, that that is what the patient is going through. But like I said, it would be important for her to have a balanced diet. Reason being, some of those things either make you also add a lot of weight, and then they give you even complications like a lot of sugar, a lot of carbohydrates will now make you have maybe an elevated BMI, and then that can now topple you over now into something like gestational diabetes. Yeah, so I know the cravings are there. We acknowledge that they are there, but it's important to try as much as possible that you're ensuring a balanced diet. Yeah, because it can have an impact, you know, an impact on your pregnancy outcome. Yeah.
And you know, funny thing is, whenever I could eat chips, whenever I could eat pizza, I could never, I never vomited.
You never vomited.
But anytime I eat anything else, everything out.
It's good to talk to your health worker. At least they can help you manage the nausea and vomiting, at least to allow you to be able to eat a proper meal. Yeah.
Wow. Interesting.
Yeah.
And now, maybe you can highlight to us why is it so important that every expectant mother has to go through the antenatal care?
Okay, thanks a lot for that question. Antenatal care is, I would say, very, very, very important. It allows you to interact with your health worker, your doctor or midwife throughout your pregnancy journey. Why? Because pregnancy is it's a physiological state where you need to have a healthy outcome. And the healthy outcome is both for the mother and the baby. So what does antenatal care allow you to do? During this interaction, you're able to actually promote. So you can promote, you know, health education, how you can improve your nutrition for a positive outcome. During this interaction with your health worker, if there are any complications, they can either be prevented first before they occur, or even if they occur, then they will be managed. And remember, even we are preparing you for delivery. During your antenatal care, we'll also be discussing about what to expect, because eventually you'll either go into labor or maybe need to deliver through cesarean section, and how do you manage yourself even after delivery. So I would say it's very, very important that while you're pregnant, that you should be able to see your doctor, because it's a very pregnancy can sometimes be high risk. Yeah, so it's good for those risks to be managed early so that you can have a good outcome at the end. Yeah.
Okay. And you talking about, you know, trying to monitor each and every step. I could, you know, there are things like fetal heart.
Yes.
There's things like weight. So what else? What's that process like, so that you know the baby is okay, the mom is okay? Okay.
So we usually we end up having two people.
Yeah.
So we have the mother and the baby. So when you come in for your clinic, the first thing I want to check first, like for the lady, first of all, even how is she doing? You know, like since the last time you were here, what have you been experiencing? You're going to explain to me, you know, maybe I had a lot of vomiting, I've not been able to eat, or I had a lot of pain, you know, then we find out what is the reason for the pain, or maybe I had a fever, so maybe you had some infection. So at least first, I need to find out from the mom, so far, how are you feeling? Even sometimes even just your mood. Are you extremely tired? Are you having, you know, sadness? Because it can really change your body. So finding out from the mom, first of all, she's going to tell me how she's feeling. Then we do some measurements, and we measure your vital signs. So we want to take your blood pressure, and your blood pressure is very important because for some women they develop hypertension in pregnancy, which can lead to other complications, and even what we call preeclampsia, and can even give you what we call eclampsia. You can actually have very elevated blood pressures that cause even up to convulsions and a poor outcome. Then I'd like to see even things like your temperature. Are you having infections which you've not been able to pick? That is going to be another sign for me. Your pulse rate. Maybe you're having anemia, or you have like an elevated pulse rate or something like that. I'll be able to pick something from that. Then now examining the mom also first. Ensure that she's okay. Does she have any other issues? Other than being pregnant, she's also still a person, because she could be having another problem. So do a full examination of her. As I examine her, at the abdomen, I'm going to be able to examine the baby, because that's now where we are having the fetus developing, because the uterus is getting bigger. So I'm able to, first of all, even just with the size of the uterus, be able to tell. If I'm expecting you to be 20 weeks by your dates, is this baby growing according to what we are expecting? So we measure. You'll notice the doctor will always be what we call palpating, checking.
Munashikanga hivi. So at some point I ask myself, okay, how do you know?
How do you know? Yeah.
Huyu ni mtoto ako you know.
Ndani,
you cannot, but through nyinyi kuweka tu mikono hivi, you can tell like this.
It's very interesting. Okay, it takes a lot of training and practice, and that's what we are trained to do. So maybe for us it looks easier. So I'll be able to check, let's say you're 37 weeks. Yeah. So when I check your abdomen, I'm expecting the baby to be also around the 37 weeks. So I should be able to tell, has this baby grown according to what we're expecting? As I'm checking that, I'll be able to tell the position. Like I expect to find maybe the head is down, because for a normal delivery, the head has to be the one coming out first. So you're also able to pick up positions of the baby. Then from there, I'll also listen to maybe the fetal heart. You expect it maybe to be between 120 to 160. You know, if it's abnormal, then I'll be able to pick up now from there. So antenatal care will also help me to do a good fetal assessment for the baby to grow normally, and also for us to prepare for delivery, because if there are any other problems, then you need to manage them before. And that's why sometimes you'll find the doctor will send you for a scan. Let's say I need to know the location of the placenta for me to be able to plan your delivery. Even a scan is going to help me confirm the position of the baby. Maybe what we call breech is when the baby's legs are the ones which are down first. That now means maybe you'll have to deliver through a cesarean section. So antenatal care is, I would say, is really, really good. It's an opportunity for, you know, the pregnant woman and the baby to interact with the doctor, for us to be able to plan towards your delivery. Yeah, it really determines, it helps with determining whether your outcomes are good. Yeah.
And you've mentioned breech.
Yes.
I remember with my son, that's what happened.
Oh, okay.
And you know, the other two, it was normal.
Yeah.
Now here we are. Doctor tells me now we're going for a CS.
Yeah.
I wasn't ready psychologically. I wasn't prepared. So in such a case, how do you take a mom through so that, you know, she can be well prepared even before going to the operation room, so that just to ensure they come into terms, because not everybody is like ready for whatever.
Yeah.
If you're used to a certain way, you go expecting that a similar way. But now there is change, and some of the moms, even we have fear, you know, fear of the unknown throughout the pregnancy. Unapata tu mtu akona fear, hujui nini ita happen. You know, it's, I believe it's normal, and maybe you from your end there is a way you work with the moms just to ensure they are okay, they are comfortable.
So pregnancy sometimes, I agree with you, can sometimes be a very anxious period. You know, you are waiting for your bundle of joy, and it also takes 40 weeks, and sometimes you're wondering what may happen in between, and will I end up having a good outcome? So first of all, it's good for if you're coming from a place where you're having a lot of social support, even at home first, like either with your partner, with your family, your extended family, your friends are good social support, because they, you know, they'll take you through the period. Then, of course, when we receive you here, I always encourage my patients to be very open-minded. I like what you have highlighted. Is sometimes pregnancy, every pregnancy is different, you know.
Different, yeah.
Like let's say maybe the last time you had a baby you were 25,
Yeah.
then you come and have a baby now when you're 40.
Yeah.
You're in a very, very different space,
yeah.
even in life
True.
during those periods. So, but I always encourage my patients that we have to be open-minded, because what I would call the end justifies the means. We want to make sure at the end of it all, what is our goal? Our goal is to have a healthy outcome for that pregnancy.
Yeah.
Whichever way you know it takes us. You don't have to be fixated, because sometimes even complications can occur. But if whatever you're doing ensures your safety, then that is where I would choose and encourage my patients to go. But the social support, even during the visits, it's always important. Share with your doctor.
Yeah.
Share with your nurse how you're feeling. You know, it's a long time. 40 weeks is a long time to be pregnant. So just always having a conversation with the patient, finding out how you feeling about being pregnant today. Yeah, and they'll share with you fears. You know, like someone maybe based on a previous bad experience during delivery can come into the clinic very, very anxious. So it's important that you figure that out and help her to cope. And even if you need support from a psychiatrist or even a counselor, we link you to that and even offer that.
Okay.
Yeah, if it's because some people have had, I would say, maybe very traumatic experiences.
Yeah.
And if you capture it, then it helps them to have a better positive experience. Yeah.
And maybe what would you say is most common, like most moms, ni nini wana experience zaidi in terms of, is it pressure, is it maybe kutoongeza weight, is it
I would say our most common complication maybe in pregnancy is maybe hypertension. What we call, it's a group of diseases, hypertensive diseases in pregnancy that occurs commonly. For some women, they develop gestational diabetes. So she was fine before pregnancy, but during the pregnancy, the body is unable to metabolize her sugars properly, so she may have elevated sugars. And maybe at delivery, what is very high risk, there is postpartum, bleeding after delivery. So I would say those are our biggest maybe complications of pregnancy. Yeah, because some of the other symptoms that patients are having, you can develop hypertension. That means your baby maybe is not growing well. Yourself as a mom, you're at risk of even either severe hypertension, where it causes damage to your other organs and can even give you even convulsions. You'll miss things like diabetes. Diabetes can cause first of all, organ damage for the mom, and even for the baby, you end up with a very big baby. And then I'm forgetting what else. The diabetes can cause intrauterine fetal death. So I would say missing clinic, it's a very, very big missed opportunity. There are a lot of things that are positive that happen, even health education. How do you manage your nutrition, your hygiene, preparing you for breastfeeding, preparing you for labor, your psychology, there's a lot that is done during the clinic. So it would be very ideal for someone to be able to attend their antenatal clinic. We understand for some people it's an issue of maybe where they come from, a social-economic status or a lack of infrastructure or the culture of the people. Although I think the government has really been trying. Right now, I think the current statistic is they've been able to achieve 88% antenatal coverage, that every woman who is pregnant is able to see a health worker during her pregnancy. But there are still, of course, challenges that are making them not able to achieve full 100%.
Wow, interesting. I'm sure we've learned a thing or two. And, it's very important to realize how, how God created, how God makes it possible for, a mom to carry a human being for 9 good months. And, the kind of knowledge and I would say grace that He gives you, the experts, to walk with us through the journey, because I would say you need someone to walk with you in that journey, kwa sababu yenyewe we have so many, tunakuanga na unaweza amka hata hujielewi uko aje leo, kesho tena uko vingine, the next day uko hivi, and finding that that kind of care whereby someone is working with you, anakuelewa, they are ready, you are ready to like enlighten moms on on the journey, on the things they should do, the things they shouldn't do. You know, it's very interesting. And I understand you also have, I think, is it Emory Moms?
Yes, yes, we do.
You know,
yeah.
I found that very interesting because, you know, moms coming together, celebrating the journey together. Tell us more about it.
So Emory Moms is we have an event. We try and do one at least every quarter, and we choose a topic. So we mix all the moms. Have you just recently had a baby? Are you pregnant, waiting to have a baby? Is your baby 3 months or 6 months? So we offer them an opportunity to just give health promotion. Sometimes during the clinic, maybe not everything may be covered, and then so during the event, you're able to also learn from experiences of other mothers as they ask questions, and also it gives them an opportunity sometimes even just to socialize. You can imagine taking care of a baby sometimes, you don't get time even to go somewhere to sit and have some, you know, just some quality time.
True.
So during this event, we have the nurses doing some talks. We sometimes I also do talks also for the gynae part, and we also invite a nutritionist, and we invite the pediatrician, and then we cover the areas that we think we highlight the areas that we think are of priority, especially for moms, to ensure that they're being able to take care of themselves and their newborns well. And we, you know, the topics will be based also on the feedback that the mothers are giving us. So we try and do one every quarter and just use it for health promotion, basically. Yeah.
Wow, interesting. And Mimi, every time I always say parenting, we don't have a manual.
That's
you know,
true.
We all parent in different ways, but at the end of the day, we want to ensure that, like, we are bringing up, you know, kids the best way possible.
Yes.
And here at the Parenting Cafe, what we usually do is, you know, we want to bring experts our way so that moms out there can interact with you and, you know, any questions they may be having, they can direct them to you so that you are able to guide them in each and every step of the way, just to make their journey, you know,
easier,
you know, and memorable, because we don't want to have you with baby number 1 and you are saying, hey, no, I don't want that experience again. You're with baby number 2 and you're like, I don't want. So at least having someone like you to work with moms. So in case you have any question that you would want answered, our able doctor is here. We'll be very glad to get back to you so that you can get assisted, because at the end of the day, we want to get help for each and every person out there. And again, always seek medical attention whenever you feel that you need to do so, because usikae ukisema utatafuta advice kutoka hapa. We always say it's best to get advice from the specialist. So I'll give you, Daktari, a moment to tell us your parting shot, just to, you know, summarize everything and a parting shot.
Thank you so much, Juliet. I think for me is to encourage women to seek care from the right places. We are here, we are passionate about what we do, we are trained to serve you, so give us the opportunity and give us the opportunity to journey with you. We want you to have a very positive experience. So come, we are open every day. If you have any issue, karibu, come, we discuss, because we are here to help each other. Yeah.
Thank you so much, Daktari. It was nice, you know, interacting with you. I always say each day is a learning process. Even me with penye niko leo, I keep learning each and every day, because parenting, you know, it's a daily job. Unafanya kila siku, hata kama uko baby number 1 na uko baby, you find yourself hata from baby number 1 the experience was different, baby number 2 different, baby number 3 all of them wako tofauti. So thank you so much, and we are looking forward to having, you know, more and more conversations so that we can, you know, help moms out there, even dads out there. We can make parenting easier for a better, you know, for a better community.
Thank you
so
so
asante
much.
sana.
Asante sana.
Thank you so much for joining this conversation. It has been a pleasure, and I still insist, for any questions, just drop them hapo tu kwa message and zitafikia daktari. So thank you so much. Until next time, bye bye.